So far we talked in detail about the congenital anomalies of the vagina. Then we talked about the congenital abnormalities associated with uterus, what's their classification, what causes those abnormalities. We also talked about some abnormalities of the fallopian tubes. Now in the end and in the last section of our topic, congenital malformation, we will talk about some other anomalies. And in this, we will talk about some anomalies of the ovaries, Wolffian remnant abnormalities, and some other abnormalities. Now, the anomalies of the ovaries. Ovaries are the gonads, female gonads, and ovaries produce hormones, estrogen and progesterone. Both these hormones are important for the development of the female secondary sex characteristics. So ovaries are the female gonads. Ovaries are attached to the fallopian tubes. At the end of the fallopian tubes, they are attached. So in this, we have these are the fallopian tube. This is the broad ligament. This is the diagram of the infant uterus when the ovaries are the streak ovaries present attached to the broad ligament, and later on the ovaries grow and they become attached to the fimbriated end of the ovaries. So once the ova is released by the ovary, it is caught up by the fimbria of the fallopian tube, and from there the movement of the ova towards the uterus starts. So anomalies of the ovaries. We have streak gonads or gonadal dysgenesis. Sometimes the ovaries, they do not develop, they stay as the streak ovaries, and this is gonadal dysgenesis. We might have accessory ovary, or we have supernumerary ovaries. We have the accessory ovaries, and then we might have supernumerary ovaries. Then the Wolffian remnant abnormalities, in which the outer end of the Wolffian duct may be cystic, size of P, often pedunculated and attached near the outer end of the tube. So this is remnant abnormality. This is the ovary. If you see here, the ovary. But in this is a big cyst present, and this is one of the Wolffian remnant abnormality when the outer end of the Wolffian duct become as a cystic. Cysts are the fluid-filled sac, which is a pea-sized cyst, and it is maybe pedunculated. It is attached with the stalk, or it is attached to the near the outer end of the fimbria. So this is the condition in which a big cyst develop, and it is due to the at the outer end of the Wolffian duct. Then cystic swelling also from the Gartner duct. Again, Gartner duct can also lead to the formation of the cystic development. So it is the abnormality both from the Wolffian duct and the Gartner duct. And it may be para-ovarian cyst also. Para-ovarian cysts are the cysts present around the ovaries. Some other abnormalities present, we have the labia, in the labia minora, labial fusion is present, lack of the opening, so the labia minora are fused together. Then in the labia majora, we have hyperplastic or hypoplastic labia, excessive growth or the less growth of the labia. Then in the clitoris, there is clitoral hypertrophy, sometimes also present. So these are some other abnormalities present in the structures like labia majora, labia minora. There may be fusion, absence of fusion, or hyperplasia or hypoplasia present, or there may be clitoral hypertrophy. In the perineum differentiate from the area of contact between urorectal septum and the dorsal wall of cloaca at about 7th week. In the perineum is the area between the vagina and the rectum. So area between the vagina and the rectum is known as the perineum, and it forms from the urorectal septum and the dorsal wall of the cloaca, and it's about around the 7th week during the embryonic stage. So that was all about the congenital abnormalities that involve different structures of the female reproductive tract. Thank you for watching sqadia.com.